One of the common questions that I frequently get asked is, am I a candidate for a partial? Or what is a partial knee replacement? In today's video, I'm going to show you what a partial knee replacement is and help explain to you who is a candidate for and who is not a good candidate for partial knee replacement. Hello viewers, I'm Adam Rosen. Thanks again for tuning in. If you have not already, please subscribe to this channel so you get updates when videos like this come out. And if you have not already, please click the thumbs up and like button so people like you can find information and videos like this. In today's video, I'm going to talk to you about partial knee replacements. And the first question people ask is, what is a partial knee replacement? And a partial knee replacement is just that. It is a knee replacement of part of your knee. We're really talking about three parts of the knee in our world. There is an inside, or what we call a medial compartment. There is an outside, or what we call a lateral compartment. And there is a kneecap joint, what we call the patellofemoral joint, or a patellofemoral replacement. Now, some patients have arthritis in only one area of the knee, just particularly, say, the inside or medial compartment. It's the most common partial that we do. And in those cases, a patient may be a good candidate for a partial knee replacement where we replace just that 1/3 of their knee. But some patients have arthritis in 2 or 3 compartments, or they have a significant deformity. So in certain instances, when you have arthritis in 2 or 3 compartments, or you have a significant deformity, you're not a great candidate for a partial. And the best surgical treatment for you would be a full or total knee replacement. So hopefully you've watched some of my other videos and you've seen the video about knee replacement where I describe with a knee model what a knee replacement is. And this is a partial knee replacement. So if you can see, we only replace a part of the knee. This other half, the outside, or what we call lateral compartment, is still the normal knee. And inside the knee, you can see these 2 crossing fibers. Those are your cruciate ligaments. The front one is called the ACL, or anterior cruciate ligament, and the back one is called the PCL, or posterior cruciate ligament. What I don't have here, though, is a kneecap, and typically there would be a kneecap up where my thumb is that rides in this groove. So in a partial, we're leaving your kneecap. We're leaving the kneecap joint of the thigh bone. We're leaving the outside half of your thigh bone and shin bone. We're leaving your cruciate ligaments. We're leaving the side ligaments called the collateral ligaments, but we're replacing the bad cartilage on the end of your thigh bone and the top of your shin bone, and replacing them with metal and plastic. So now as you bend and straighten your knee, you have metal rubbing on plastic, where previously you had bone rubbing on bone. So what about rehab? Patients commonly want to know, if I have a partial, won't it be easier? And yes, it's still a big operation. I mean, we're still taking a saw to your bone, we're opening up your knee joint, we're removing bone and cartilage. But most patients that have a partial knee replacement, when compared to patients that have had a total knee replacement, will report less pain than a full knee replacement, a slightly shorter recovery, a slightly easier recovery, but it's in no way easy. It's still a big surgery, it's still a big rehab, but yes, the recovery usually is a little bit shorter and the pain is usually a little bit less. And when patients come and see me for total knee replacements, a common question is, will it be like my normal knee? And you may have seen this or heard me talk about this before in previous videos, but I use a scoring system. I'll describe a scale of 0 to 10, and at 10 is a perfect normal knee. Most knee replacements in the world today are usually at best an 8. There are some occasional 9s and 10s out there, but most people are an 8. So if you're a 4 and you go from a 4 to an 8, it's 100% improvement. But when I talk to patients about partials, most patients that have a partial knee replacement, it's more like a 9 out of 10. It's very, very close to your normal knee. And it makes sense, right? Because when we replace your knee, a full knee replacement, we're replacing the cartilage and bone on the kneecap, thigh bone, and shin bone, removing the anterior cruciate ligament if it's there. Most patients don't have one if they have arthritis. When we do a partial knee replacement, we only replace 1/3 of your knee. So the other 2/3, the cartilage, the meniscus, the cruciate ligaments, they are all still yours. So patients that are good candidates for partials can have a successful partial, but if they've had a total knee replacement on the other side, and you ask them, they will always say that the partial knee feels more like their normal knee. And it's because we've only replaced a part of their knee. Well, people always ask about what are the downsides or what are the complications or the cons of having a partial knee replacement. Well, when it comes to certain things, you can look at my other videos that talk about complications of knee replacement because things like infections and blood clots do occur. But when we talk specifically about partials, one of the most common issues that we run into is the need for a revision, the need for a conversion of your partial knee replacement to a full knee replacement. Now, that most commonly is due to adjacent arthritis. So you had a partial on the inside, and now you've developed arthritis underneath your kneecap or the outside half of your knee, and you failed conservative care. The only treatment option there is to then go in and convert that to a full knee replacement. Now, there are a few people out there that do a second partial, but those are rare. Most doctors will recommend going to a full knee replacement. Now, this can occur early, so we do see some early revisions where patients have a partial, do not have complete relief of pain and symptoms. Maybe it wasn't the best choice to do a partial and they have an early conversion to a full knee replacement. More frequently, this happens down the road. So knee replacements at 20 years, full knee replacements. At 20 years, 90 to 92% are functioning just fine. And studies will vary on partials, but most will discuss between 10 to 15 years. Again, that survivorship is about 90%. So it's not that most partials fail earlier when we talk about the plastic bearing. It's more patients that have a partial in 10 or 15 years will develop arthritis in other parts of their knee and need a conversion to a full knee replacement. Now, there's one other issue that can occur, and it occurred more frequently years ago with older designs, and it's very rare nowadays, but it can still occur. And who can this occur in? Typically people that have weak bone, osteoporosis, which is more frequently seen in females as opposed to males, and people that are significantly overweight. And what can happen is that shin bone part is then perched on that soft bone on the inside or outside half of the knee, depending on what kind of partial you've had. And that bone can collapse or the component can subside and the bone can break or fracture. And in that setting, the patient then needs another surgery, typically a conversion to a knee replacement with revision components to repair the damage that has occurred to the bone. And this is something that we don't see very commonly with full knee replacements because you have a larger base plate and that weight or force is distributed across a larger area when compared to the partial knee replacement where we're basically covering only about 30 to 40% of the shin bone on one side or the other. So that's sort of the Cliff Note versions of partial knee replacement. What is it? Who's it indicated for? What are the risks and complications? And I hope it's answered most, if not all, of your questions. So thanks again for watching and thanks for tuning in. Until next time, I'm Adam Rosen. Stay safe.